Hello everyone. Today we will see mental health nursing second year GNM important question for examination. We'll see first 4 or 5 marks question. In that first one is substance use disorder mental status exams. The mental status examination is repeatedly they're asking this question. Mental status examination. So many papers, so many years papers I seen this one. Mental status examination is repeated question. Then principles of mental health nurse also repeatedly they're asking this question. Principle of mental health nursing. Next, qualities of psychiatric nursing. Then communication skill. History of psychiatric sources repeatedly they're asking history of psychiatric nursing. Then psychiatric emergencies repeatedly they're asking the psychiatric emergency question. Next, mood disorder. Then role of a nurse in the psychopharmacology. The psychopharmacology also repeatedly they're asking this question. Next, alcoholism. Prevention of mental illness during adulthood. Next, 12th question, anorexia nervosa. This one anorexia nervosa, otherwise they'll call it as eating disorder. It is repeatedly they're asking this anorexia nervosa. Next, therapy is mainly behavioral therapy. They repeatedly they're asking the behavioral therapy. Next, legal responsibility of psychiatric nursing. Then process recording also they're asking 2, 3, 4 question papers. I saw this one. Process recording. Next, community mental health nursing. This also repeatedly they're asking. Then Indian Lunacy Act 1917. This question also repeatedly they're asking. Then techniques of crisis intervention is a repeated question, is important question, the crisis intervention. Next one is delirium. Then Mental Health Act 1987. The Mental Health Act also is repeated question. Then interview technique, mania, and antipsychotic drugs. The antipsychotic drugs repeatedly they're asking this question. Then rights of mentally ill patient. This also repeatedly they're asking. Then individual therapy. Next, group therapy, delusion. Then psychotherapy is repeatedly they're asking the psychotherapy. Then depression. Then admission and discharge procedure in mental hospital. This is repeatedly they're asking. Admission and discharge procedure. Then defense mechanism, repeatedly they're asking defense mechanism. Then psychosis and neurosis is repeated question, this one, psychosis and neurosis. Then bipolar disorder, this also repeatedly they're asking. The alcohol dependency syndrome, this question also repeatedly they're asking. ECT is repeated question, electroconvulsive therapy. This one is repeatedly they're asking in a mental health paper. Then ICDS classification is also important. Then therapeutic nursing patient relationship, maladjustment, psychotropic drugs also is important. Dementia. Then mental health team. This is also repeatedly they're asking mental health team. Then national mental health program. This is also important question and repeated question, this one. Role of nurse in their therapies while doing the therapies. What is the role of the nurse? That they'll ask the repeated question, this one. Withdrawal symptoms. Then manual therapy, family therapy, trends in psychiatric nursing, and phases of relationship. Totally 50 questions I given for 4 marks and 5 marks. In that, while I am saying itself, I said this and all the repeated question. Once if you go through it, everything for the examination is well and good. Next we will see answer the following. In answer the following, first question is schizophrenia. It is a repeated question. Every year they are asking this question, schizophrenia. Then causes and clinical manifestation of schizophrenia and management of patient with schizophrenia. This is a repeated question, this one. Then second one is define psychosocial therapy. Explain any two psychosocial therapy. This is also repeated question. Then third one is phobia. Phobias repeatedly they're asking this question. Either they'll ask for 5 marks or 4 marks. Otherwise long answers they'll ask. Phobia, the types of phobia and clinical features of phobia and management of phobia. Then define OCD. OCD means obsessive compulsive disorder. This also is repeatedly they're asking this one. Next one is personality disorder. Personality disorder, repeatedly they are asking this one. And I said ECT is repeated question. Either they'll ask for 4 mark or 5 mark. They'll ask means they won't ask for long essay. If the long essay they'll ask means they won't ask for 4 mark and 5 mark. Then define mental health and mental illness means what? Then characteristics of mental health person, prevention of mental illness. This also is repeated question. Next one is psychotropic drugs and classification of psychotropic drugs. This is also repeated question. Then suicidal attempt or definition of suicidal attempt, causes, what is the causes and clinical manifestation. Then management of suicide, this is also important question. Then mental retardation and causes and clinical manifestation and management of mental retardation. This is also repeated question. So far we will answer the following. Total 10 important questions I given, 50 I given. This is useful for your examination. Next class we will see, and thank you.